The full approval could happen as early as next week. And joining us live now is Dr. Ron Berrol, Medical Director of the Emergency Department at Sutter's Alta Bates Summit Medical Center in Oakland. And Doctor, thanks for joining us first of all, but got to ask you, how big a game changer is this full FDA approval for the vaccine?
I think it's a pretty significant thing. It's going to give us a lot more options to make sure we can protect the maximum amount of our population. I'm very excited about it.
And for anybody who is planning to go out to eat this weekend with the Delta variant that we're dealing with, and it's spreading, and all the wildfire smoke on top of it, is your recommendation to eat indoors where the COVID transmission might be higher, or do you eat outside even though you might be breathing that dangerous air?
Well, I think you always have to consider what's going on in the community. And what I mean by that is with the Delta variant. If you had asked me a month ago and we had smoke like this, my answer would be slightly different. But because we're in a time when there's a lot more community virus around, and we're seeing some breakthrough as the vaccine wanes a little bit, I think it's a time for people to say, you know what, I'm going to step back and not do as much as I was a month ago. And understand it's probably temporary until we're over this surge and we can return to the habits we want. So I think because the Delta variant is so prevalent now, I would say maybe you should even consider not going out to eat or doing more takeout. And I think you can check the AQI, the air quality index. And if the air quality index, say it's morning at brunch and it's 27 or 30, well, maybe you can go and eat outside. And maybe if it's 120, that's a time to think either inside or outside. There are risks. And maybe I would choose not to. So that's how I personally approve it or make my own decisions, is based on those variables. So I'm not giving you quite an exact answer.
Well, no, but it's sort of a play it by ear and use your common sense, I suppose. You have to weigh the risk and the benefit. But let me ask you about the younger kids, the ones that younger than 12 that can't get the vaccine. Now that they're back in school, should the schools keep them inside, increase their chances of spreading and contracting COVID, or what about their playtime outside?
Once again, checking the AQI is very valuable, because there are going to be times when you can do things outside, and there'll be other times when it's really putting people at risk. So kind of being ready to be flexible as you go throughout the day is important. But also, we don't really know the full effect of having all these kids back in school, and if a school is having a masking policy, what that effect looks like yet. We think that kids are more susceptible. We're going to see more kids getting COVID with this Delta variant, but it's kind of, we're figuring out as we go. And I hate to pull a trigger either way too quickly, because I think that we've seen that kids are more resilient, and we've seen the effect of keeping kids out of school for a full year. So it is more nuanced, and once again, I'm not giving you an exact answer. I apologize.
Well, that's okay. I understand it, and I think a lot of people do too. But let me ask you about boosters. Overall, booster shots a good idea, and if Pfizer's getting the full FDA approval, should people ask for that one?
Yeah, I think boosters are a really good idea. The mRNA vaccine has been amazing in its safety and its efficacy, but we didn't have a chance to test it out long term. And so what we're learning now is that it does wane over time, but it appears to be incredibly effective. And that booster will allow people to maintain that immunity, which will give us those options of maybe doing more things inside with friends and stuff when we're in a bad air quality time like this. So I think it's only going to give us more options in our daily life and offer more protection. But we're learning what the proper series and time frame between vaccines are as we go along. So I'm very encouraged by it. I'm going to get it as soon as my number comes up. And I think it's a very safe thing, and it's great we'll have this option.
What about kids younger than 12? Do you think we're getting close to being able to vaccinate the younger kids?
Yeah, I apologize. I'm not up on the exact last data, but I do know that the trials going on are very encouraging in terms of safety, and they're just trying to figure out now what is the proper dosage and spacing of the vaccine, because we want to have the maximum protection. And we've seen what happens when we rush to do things during this time of COVID, and then people second guess. So I think taking an extra week or two so that people have confidence in the decisions can be the right step.
They can go a long way. All right, doctor, thanks so much. Have a great weekend.